Interesting things that we've got into. So again, welcome to our Saturday morning webinar. I'm in Los Angeles. If you feel like it, put it in the chat where you're joining us from today. My name is Ankur Patel, Director of Advancement for Hindu University of America. And today's webinar is Yoga for Back Pain, Perspectives from Modern Research and Holistic Healing. So let me give our guest speaker a quick introduction. Vinuta ji has her yoga certification from SVSA, and she started on this journey when she got on that yoga mat at 14 years old. It's been life-changing for so many people, including Vinuta ji, and it's helped her stay grounded through the years. Maintaining innermost, that sense of peace is always a challenge, but she's here to help us not just address our back pain, but that holistic approach to yoga and what it can help us do, right? And make ourselves better, make our lives better, and help to share this ancient wisdom with you and as many aspirants as possible. So with that brief introduction, let me hand it over to Vinuta ji, and she has her presentation ready to go and we can get started. Welcome. Thank you for joining us today.
Yeah, thank you, Ankur. That was a lovely introduction. And yes, I'm eager to get started because there is so much to share with everybody, and we want to make sure we get in some of the some webinar content in there, as well as some information about the courses, this course in particular, as well as other courses which are upcoming. And finally, in the end, we'll have some Q&A, and we'll get all those questions answered. So without further ado, let's get started. And as Ankur said, today's topic is perspectives from modern research and holistic healing. And what are we going to be doing today? We are going to, first of all, have a little hands-on experience of yoga as a therapeutic practice. So we are going to get an opportunity to lie down on the mat right in the morning today, or sit on the chair if you're not comfortable lying down, and experience a few practices that we teach. And then we'll move on to learning a little bit about what does modern medicine have to, what solutions does modern medicine offer with regards to back pain management, and then evidence-based yoga intervention for back pain, and then moving on to the yogic approach to back pain. What is this back pain management? What is it based on? And techniques for healing back pain, and a little information on this course as well as other courses offered by Yoga Bharati through HUA. So I would invite everybody, if you have a mat or if you have a carpet there, please lie down on the mat or carpet. I'm not able to see anybody, so I just have to assume that some of you are lying on the mat. And this practice can also be done on the chair. So if you're not comfortable lying down, you can also do it on the chair. And I'll just, my mat is there behind me. So we'll take about 5 to 10 minutes, and then we'll just do a few practices so that you experience what it is, what this course is all about. So first of all,
would it be okay to unshare the screen so that they can see you fully?
Unshare, okay.
Yeah, thank you.
Okay, so I think I'm visible now. So let's get on the mat. I'll show you on the mat, and we can, as I said, do it on the chair as well. So let's do a little bit of practice, a small practice for, say, if you have an acute back pain. Okay, we are assuming that everybody has an acute back pain. We don't want to do any of the slightly more tougher practices today. So just an acute back pain. Okay, you got back pain, and what are you supposed to do? So you're lying on your cot, you're lying on your bed, and then this is the simplest practice that one can do to release that muscle spasm. So please lie down on the mat. And make sure that both your legs are bent at the knees, very comfortable here. Feet are placed slightly wide apart. Close your eyes and bring your awareness to your abdomen. Okay, so become aware of your pelvis and your lower back. Now, as you exhale, you're going to tilt your pelvis towards your head, very slight and subtle movement, tilting of the pelvis towards the head. And then as you inhale, tilt that pelvis towards your feet. So imagine that your pelvis is like a big bowl of water. And as you exhale, you're going to tilt that pelvis towards the head, tipping the water bowl towards your head. And then as you inhale, tilt it forward. As you tilt your pelvis towards your head, feel the tailbone pressing onto the mat, the lower back. All the muscles are pressing onto the back, onto the mat. And then as you exhale, the tailbone comes off the mat slightly. So this movement of the pelvis, a very subtle movement, but become aware of how beautiful it feels. So use the breath here to guide you. Breath is the most important thing here. Exhale, tilt that bowl towards your head. Inhale, release the breath. And we're going to repeat that a few more times. And the same thing can be done on the chair. If you're sitting on the chair, you want to kind of move your pelvis forward towards the screen and then back towards the backrest. And ideally, you should have a chair with a backrest. All right. So that's one practice. Feel free to continue to do that a few times, maybe about 10 to 15 times. And in fact, take it home. If you have an active back pain, try it out, write to us and let us know if it was effective. So continue to lie on your mat or sit on your chair. Let's do some neck movements. And I know this is a back pain course, but neck pain is also a very common thing seen. So let's do some supine neck movements, keeping your head facing the ceiling in the beginning. We're slowly going to turn our head to the right, turn our head to the right, exhale, breathe, and the neck slowly comes all the way to the left to the best of your capacity. And then inhale, look at the speed, nice long inhale, and the head comes back to the center. Exhale, now to the left, head turning at a slow speed, matching the breath, and slowly head comes back, comes all the way to the right, and then inhale, slowly bring the head back to the center. A few more times here, matching the breath with the body movements, and if you're sitting there, Ashwini is showing you what to do with your neck. So one, you can also count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Enjoy the stretch. Do not push yourself. If you feel any kind of discomfort, back off. And now let's begin the journey back to the center. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Back to the center. And if you like this practice, take it home, practice it, or you can do it one more time. Finish your round. You can complete the round on the other side, counting, or you may also use a chant. So using the chant as you take your head all the way to the left, and then inhale, slowly bring your head back to the center. Simple neck movements, complete awareness on your neck muscles, on the spine in your neck, and enjoying the practice and breathing. So this is supine neck movements, or you can do it on the chair as well. A couple of more simple practices. One more practice for the neck is a chin tuck. So if you're lying down, then you simply make a double chin. We hate those double chins. So now we're going to make a double chin by tucking the chin into the throat. Very gentle movement, tucking the chin into the throat, and then release. You may also add the breath if you want. Exhale, tuck, inhale, release, or you can go a little faster. Exhale, tuck, inhale, release. And if you're sitting, then Ashwini is showing, just taking your head or head back slightly. So usually our neck is sticking out like this and we get a crick in the neck, we have all kinds of issues. So just tucking it back, release it. Tuck it back and release. So I want you to practice this if you have neck pain, very, very effective, and you will feel immediate relief in 10 minutes after doing this practice. And you can do a few rounds of these, 10 to 20 rounds of these, very gentle practice. So moving on to the next one. One more practice to strengthen your lower back. And again, listen to your own body. We don't know if you have an active back pain, what your condition is. So listen to it. Any sharp shooting pain, back off. Otherwise, you can do small lifts, micro lifts, bending your legs at the knees, both palms on either side of your hips, and slowly raise your hips to the best of your capacity. Raise it up, inhale, and then as you exhale, completely lower the lower back, the tailbone, all the muscles. Allow it to spread out. Inhale, raise, use the breath, and tighten your glutes slightly as you lift. And without any jerky movements, exhale, lower the back down, allow the muscles to relax, and inhale, raise up to the best of your capacity, and exhale, lower down, release the tailbone and all the muscles. Enjoy that relaxation before going on to the next inhale. Raise up, strengthening the muscles of the glutes, of your back, of your core. So all the supporting muscles of your back are being strengthened. A few more rounds. Be mindful of the inhalation and exhalation. As you lift, you're inhaling, and as you come down, you exhale and let go. Take your time, no hurry to speed up the practice. And since I'm not able to see any of the participants here, I'm assuming that you're all okay. And if you do experience something, we have questions towards the end. We have a Q&A session and we can take some questions on these practices. So we'll be introducing many such more practices in the course, and feel free to do these few practices at home in the meantime. Okay. So going back to our webinar here, this is a little graph that I found, and this is from the CDC website. And there have been so many studies that have been done on back pain. And what are the statistics for back pains? A lot of studies have been done, a lot of research has been done. And research indicates that studies indicate that the most common reason why people visit doctors, physicians, is because of back-related issues. And when we say back, it's not just back, it's back and neck pain, right? The whole system of the spine. And 80% of the adults experience back pain in their lives, and 10% of the world's population at any given time is said to be suffering from back pain. And it is one of the most common causes for missed work days and doctor visits. And Americans are spending a whopping $50 billion on back pain management, back pain treatment. And about $100 billion, it is estimated, is the cost, very high cost here. So $100 billion, it is estimated that is the cost for missed work days as well as lowered productivity. And about 29% of the people who have back pain say it is because of stress. And we are seeing more and more number of people who have desk jobs saying that they have back pain. So initially it used to be people with a lot of hard manual work that used to come with back pain, but more and more they are seeing a rise in the number of people who are desk workers. So that shows that the increase in sedentary lifestyle. Modern lifestyle has become very sedentary, and the result is seen in physical ailments like back pain. So this little chart here shows that, it's pretty interesting that they have done all kinds of studies, and this one shows in a little graph shows the women indicated in dark blue, the men in light blue, and it is showing that the prevalence of back pain in men and women as they age. So as you can see from the graph, so both men and women are aging, 18 to 44, 45 to 64, 65 to 74, and so on. And you can see that the prevalence of back pain is also increasing. However, women are suffering more from back pain than men, more prevalent in women as compared to men. So at age 75, for whatever reason, they found out that women are still experiencing back pain, whereas in men, there is a slight drop in the prevalence of back pain. So just a little statistic there. So the point was just to show you that there's so much of studies that have been done on back pain, and all kinds of statistics are out there. And we just want to be presenting all kinds of evidence here today. That is the goal of the webinar. And moving on to the classification of the back pain, based on your symptoms and the duration of the episodes, the back pain is going to be classified as either acute back pain. If the back pain has been there for less than 4 weeks, then it is classified as acute. And if it is from 4 to 12 weeks, you've had this back pain or neck pain, then it's subacute back pain. And then chronic back pain is one that lasts for more than 12 weeks. So that's how they classify. And why is this important? We'll see when these terms come later on in the webinar. I just wanted you to understand what this is: acute, subacute, and chronic. And if any of you has back pain, then you know where you fall, which kind of back pain you have. So some studies have been done, and the studies have shown that most patients with acute back pain, okay, they have self-limited episodes, meaning that these episodes resolve on their own. So many do not seek medical care for this acute back pain. They usually take rest and then use some over-the-counter medications, heat or cold packs and such things, home remedies, and then the issue gets resolved. And patients who do seek medical care typically improve rapidly in the first month. Now, up to one third of the patients, they reported back pain, persistent back pain, and the intensity was moderate 1 year after the acute episode. So even after 1 year of the episode, they had this moderate intensity back pain. And 1 in 5 people are saying that they have limitations in physical activity. So just a little information there. So what does modern medicine have to offer for back pain management? And modern medicine, full credit there. They have excellent diagnostic modalities to diagnose the back pain. They have all kinds of technologies. And this is not to go too deep into all these things, but just if anybody is interested, and some of you might have had these things done on you as well. So we have X-rays. The X-rays are showing the alignment of the bones. So it shows whether you have arthritis or broken bones. However, it's not going to show problems with your spinal cord or muscles or nerves or discs. All the soft tissue issues are not going to be showing up on the X-ray. And then we have the MRI and the CT scan, which is commonly recommended nowadays. And these reveal the herniated discs or any problems with the bones, muscles, tissues, tendons, blood vessels, ligaments. All these are captured on the MRI or the CT scan. And then in certain cases, very specific or special cases, they might order blood tests to determine if you have any kind of infection or things like that. Any other abnormalities that might be causing pain. And in rare cases, a bone scan might be ordered for you to look for bone tumors, compression, fractures caused by osteoporosis, that is the low bone density, right? So these are some of the diagnostic modalities. And then we also have nerve studies. So sometimes you have that pain and they know it's a herniated disc, and you need to confirm that that nerve is pinching, the nerve is being pinched. So how do you do that? So they do the electromyography and they confirm the cause of the pain. This is also done in case of spinal stenosis, where there is a narrowing of the spinal canals, like the channel through which your spinal cord passes. That's the spinal canal. And in a condition called spinal stenosis, where there's narrowing of that canal, they order these nerve studies. And then we have the SPECT and the PET. So all these are the diagnostic modalities. And like I said, tremendous amount of advancement has been done. However, even with all this going on, sometimes doctors still find it hard to figure out the cause of an individual's back pain. And more than half the time, they are unable to pinpoint the exact source of the pain. And again, the last sentence is not me just stating that randomly, but Like I said, a lot of studies have been done and they have found out that even with all these, sometimes it's hard to pinpoint exactly what the reason is. So treatment modalities, modern medicine, what do they have to offer? So when it comes to treatment modalities, unfortunately, somewhat they are lagging. Modern medicine lags behind the diagnostic modalities. However, there are several options available for people with pain. We have the non-invasive, non-drug pain management, and they could recommend exercise to stretch and strengthen those muscles and bring about some flexibility. And similar to, and you could do this exercise on your own, of course, or the physical therapist could lead you through these movements, and they could also tell you these movements, next time you get an acute pain, please protect yourself. These movements are not good for you. These are good for you. So they guide you through all of that. And they give you a ton of movements that are beneficial for you. So exercise and physical therapy. And then we also have the manual techniques, that is the chiropractic adjustment, which is quite commonly done these days. Many people go in for this spinal manipulation. And then we have the behavioral modification, and that involves the cognitive therapy or biofeedback. So cognitive therapy involves certain unlearning of something that you have learned, maybe your habitual responses. So now you want to respond differently. They teach you how to respond differently to situations, right? So that's cognitive therapy. And biofeedback is where a bunch of sensors are attached to various parts of your body, maybe to your muscles, maybe to your, they monitor your breath, they monitor your heart rate, and the sensors detect that you are stressed. And then you are taught to, whenever that detection happens, you are taught to now relax, do some progressive muscle relaxation or whatever techniques, and then bring those parameters back to normal. So that's biofeedback. Feedback is taken from the body using these sensors, and then you change your physiology through that information that you get. And then superficial heating or cooling of the skin, very, very common. All of us do it using those heat pads or the heat packs or the cold packs. And that's very common. And finally, we have the electrotherapy, transcutaneous electrical nerve stimulation, and a little electrical current is given to that nerve which is hurting, that little nerve where you have that inflammation or that irritation. A little electrical stimulation is given. That's called TENS, or it's a form of electrotherapy. So that's the non-invasive, non-drug. And moving on to the pharmacologic pain management, non-invasive pharmacological pain management. So we have over-the-counter pain relievers like acetaminophen, and this is usually considered safer than the other options here. And however, it's not very effective against, to bring down the pain, but it really does not reduce inflammation to a great degree. Right? So it's not really useful for many people, and very high doses, it could cause liver damage, and we all know that. And so then a little bit more stronger than that are the NSAIDs, the non-steroidal anti-inflammatory drugs. And these have, obviously they are stronger, they have much more side effects, they could cause diarrhea, nausea, and they could ruin the lining of your intestinal tract if you take these drugs over a long period of time. So, but that is routinely what people do for pain management. And then they could also be prescribed muscle relaxants. So some pills like cyclobenzaprine, metazalone, tizandine, and so on and so forth, muscle relaxants, which help relax those muscle spasms. So in back pain, those muscles are spasmed, and then you want to relax those muscles using these medications. And then we have the topical pain relievers, where you apply that cream right on your skin to relieve the pain. And then we move on to the narcotics. So severe pain, people are taking narcotics, opioids like oxycodone, hydrocodone, and we know what these opioids have done to the modern society these days, right? There's a deep risk of a good chance of addiction, especially if the doctors are not weaning you off those, not telling you exactly what to do. And if you take them for a long time, they are pretty risky. So these narcotics do work, but they work better on acute back pain rather than chronic back pain. So one has to be careful at what kind of back pain we have. And then sometimes antidepressants also work. So Cymbalta and tricyclic antidepressants also work in case of back pain. And then we go on to the invasive back pain management techniques. So steroids or blocks, injections or blocks are injected obviously into the area of pain. And then we have the radio frequency, radio ablation, which a little bit of heat is applied on that nerve to deaden that nerve. And then surgically implanted electrotherapy devices are inserted at the area of pain, and that gives out certain impulses, electrical impulses that help manage pain at the nervous system level. And then we have the cortisone or the steroid injections. We have nerve stimulators that are implanted to help manage the pain. And in the worst cases, sometimes if the pain is unmanageable and nothing else has worked, they have surgery as well. So is this pain, the common question would be then, is pain medication good or bad? So again, nobody is asking you to be off medications. We are not saying that at all, but please discuss with your doctor and how to come off the medications, how to slowly taper it down, and what else can you do to manage your pain. So do take medication, that's what is going to keep you functional, but also have other therapies going on. So is it possible to do yoga and some other alternative medicine to wean off the medicines in the long run? So about 25% of the US adults report low back pain reported low back pain in the last 3 months. And about 14% of those insured patients who sought care for low back pain were prescribed opioids. So 14% of them were prescribed opioids. So this is from the CDC. And then a couple of studies have been done here, as you can see. So opioids are continued to be prescribed for low back pain, despite an overall evidence to support its efficacy. So they are saying that, so in one study, 13.7% of 2017 visits for low back pain were associated with an opioid prescription. And another study found in 2015 that people who are not aware of the opioid, the risks and benefits of opioids, so they're called opioid naive patients. 27% of opioid naive patients received an opioid prescription. So there's the Center for National Center for Complementary and Integrative Health, the NCCIH, and a lot of research is going on to find non-drug alternatives to back pain. So these drugs do work for a short time and they do have side effects. They sometimes work on acute back pain better than chronic back pain. Chronic back pain has become more of a habit, right? It's become, it's something that it's something that remains long after the actual trauma or after the actual injury has passed us by. We have a lot of chronic back pain. So in such cases, this complementary, in chronic back pain, it has been found out that complementary therapies are especially very useful. And we have acupuncture, we have chiropractic, manipulation, massage therapy, biofeedback and mind-based treatments, and also yoga, of course. And a lot of studies have been done in each, not a lot, I would say, but some amount of studies have been done in each of these modalities. So here you can see in massage therapy, a 2015 study looked at how hour-long weekly massages could help people with chronic back pain, or chiropractic manipulation. So most recent guidelines from American Pain Society is saying that this modality is associated with moderate benefit for chronic low back pain. So we are just suggesting that complementary therapies, a lot of research is going on, and it's something that all of us should consider going forward. And of course, yoga is right over there. And in 2017, there was a study conducted by the NIH, and they found out that people who took 12-week yoga classes, so every week, weekly yoga classes for 12 weeks, experienced far less pain and had greater physical function as compared to people who just received self-care information, educational information about how to deal with the back pain. So since today's webinar is bringing in some evidence, so it's a little evidence-based webinar here today. Let's very quickly look at the research that is being conducted, and we are not going to go too deep into that. And all the citations are over here and if you want to look it up later on, feel free to do that. So there was a study that was done in, not very sure which year, in 2013. It's a meta-analysis of randomized controlled trials. So they took a bunch of randomized controlled trials that were done, and then they analyzed the results of all those trials. And they found out that yoga had a medium to large effect on functional disability and pain. So medium to large effect on improving functional disability and pain. So that was one study. And then the other one was done in 2012, and that was to determine the effectiveness of yoga for reducing perceived stress and back pain at work. So we all do have stress, but the way we perceive stress is different, right? The way I perceive stress is completely different from how you perceive the situation. We have different lenses from which we look at, with which we look at the situation. And that causes a different level of stress in me. It causes a different level of stress in you. So that's called perceived stress. So the yoga intervention, it was found that yoga intervention can reduce perceived stress and back pain and improve psychological well-being. Okay, and stress and back pain are, of course, the two leading causes of missed days at work. So it's very important workplace study that was done. And there was a recommendation that was offered. Organizations concerned about health and well-being of their employees, they said, please offer a yoga program near or at your workplace. And then, of course, they also said larger randomized controlled trials are needed to determine the broader efficacy of yoga, right? So it's always like that. Just because something was not proved doesn't mean that it doesn't work. So we still need to study a lot. We need to research, do more studies, different aspects, but just presenting some of the aspects where yoga was found to be effective. So chronic pain, what happens when you have chronic pain? It alters your brain structure and it causes changes in your brain, and these changes are linked to anxiety, depression, and impaired cognitive functions. Of course, if you have a small acute back pain that is just 4 weeks, that's not going to really affect you in any big way. But we're talking about the chronic pain here. It changes your brain structure. What happens? It brings about a reduction in the gray matter of your brain. They found out that chronic pain reduces the volume of the gray matter in your brain. Okay, and these couple of researchers that have been listed here indicates that yoga increases that gray matter, and it can relieve that chronic pain, and it also improves a person's tolerance to pain. Right? It improves tolerance to pain, and it protects against the chronic pain's effects on the brain. So how does that happen? So they found out that yogis, there was a control group and the yogi group. So the yogi group, they were taught, or they learned cognitive strategies. They were taught coping methods. And whenever they felt the pain coming on, perhaps whatever the study involved, they did deep breathing, they used the breath, they used, techniques involving the mind. So whatever coping methods that they learned, that involved the parasympathetic activation. So the rest and digest portion of their nervous system was activated. So they were able to relax, they were able to cope up with that pain, they were able to tolerate the pain, and that could have led to an increase in the gray matter. So when usually people are expecting pain, when it starts up, when it flares, just before it flares up, you have that point, right? When people are expecting that pain, they go into an anxious mode. Their sympathetic part of the nervous system gets activated, and the body does not know better. The mind is getting worried. So the body is now preparing itself for a fight or flight situation. The muscles are getting tensed, and the cortisol levels in the body are shooting up. And all these further exacerbate the pain levels in the body. So already there is pain, and now we got into the sympathetic nervous activity or activation. We got into this fight or flight. We are ready to deal with that situation. The whole body is stressed. All the fighter hormones, the cortisol, everything is shooting up, and then it further worsens the pain. However, the yogis, when they anticipate pain because of the coping strategies, the rest and digest aspect of their nervous system, also known as the parasympathetic nervous system, that is activated, and they are able to relax through that. They are able to visualize the pain going away. They are able to breathe, release that muscle spasm, relax, and manage their back pain better. So that is what this study indicated. So some recommendation, this is, let's see, this is a guideline that was put forward. And this guideline, so they have 3 recommendations, and this is interesting. And they say that for acute or subacute back pain, they are recommending non-pharmacologic treatment, like superficial heat, non-drug treatment, superficial heat, massage, acupuncture, or spinal manipulation, and things like that. And even if you do need to take in a medication, then select Nsaids or skeletal muscle relaxants. And look at this, the recommendation is pretty strong from them on this. It's a great, strong recommendation. And the second recommendation was for chronic low back pain. And they said initially you select some non-drug treatment with exercise, some rehabilitation, some acupuncture or mindfulness-based stress reduction, Tai Chi, yoga, and all the other modalities that are mentioned over here. Choose from one of these. And the recommendation is pretty strong on that as well. So then the recommendation 3 was for chronic low back pain. And suppose the response is, you're not responding very well to any of the above, the non-pharmacologic therapy, then what do? You consider using a medication, like you start with NSAIDs as a first line of therapy. And then they are saying consider opioids only in patients who have failed the above treatments, and if the potential benefits outweigh the risks for individual patients, and that too after a discussion with the patient or the patient regarding the risks versus the benefits. And look at the recommendation. It's a very weak recommendation that was given. So, and you can look it up if you're interested. All these are here, as I said. You can look it up. And then we'll have a look, a couple of, let's see here. We'll just look at a couple of more studies, and then we'll move on to the yogic techniques, which I'm sure everybody is interested in as well. So yoga treatment for chronic non-specific low back pain. So non-specific low back pain is a very generalized kind of low back pain. They're not able to pinpoint the reason. So that is non-specific. And they found out that low to moderate certainty evidence that yoga compared to non-exercise controls. So one group was given yoga, and the other group was given it was the non-exercise group, it was a control group, and they found small to moderate improvements in back-related function at 3 and 6 months. And this study was done in 2021, March 2021. And then there was one that was done in 2012, and they found out that yoga reduces pain, anxiety, and depression, improves spinal mobility, and is more effective than physiotherapy exercises. So not to say, they compared yoga and physiotherapy, and this was their finding. Okay, so going on to, that was some of the research that was done. And now that was the perspective from modern medicine, as well as what does the research have to say about using yoga as a modality for back pain management. Now going on to the yogic approach, what does yoga say? What is the back pain management? What is it based on? So This is the entire back pain therapy, or for that matter, any other yoga therapy for any other ailment, is based on the Panchakosha concept. So very interesting concept. And the yogic and the Vedantic scriptures, according to the scriptures, we exist as a five-sheathed personality, and that is known as the Panchakosha. And this knowledge is known as the Panchakosha Viveka. Okay, so as I go through this 5 layers, visualize your own self, and visualize if you can identify each and every one of these aspects of yourself. So we have the Annamaya Kosha, that's the first layer of the physical body, right? The outermost layer, the one that moves, talks, the one that you can touch. And this is made up of the pure matter. It's made up of, your body is made up of organs, and those are made up of tissues, and those are made of cells, atoms, and so on and so forth, molecules, atoms. So this is nothing but matter, the matter aspect of your existence, the Annamaya Kosha. So what you eat gets converted into this matter-based aspect of your self. So Annamaya Kosha, or the physical aspect. And then subtler and deeper to this layer, or this kosha, is the vital sheath or the energy body, and this comprises of the prana, or the vital energy. So the prana, without this prana, we are just mere dead bodies lying there, and this prana is what enlivens us. And this prana is what enlivens us, and this is what is responsible, according to the Upanishads. It controls the entire universe. It is the universal energy, you could say, that is there outside controlling the entire universe, and it is there within you as well. And enlivening your body, flowing through your body, responsible for all kinds of physiological functions that take place in your body. That is the Pranamaya Kosha. And then we move on to the Manomaya Kosha, still deeper and subtler. The mind is the most elusive thing that one can think of, right? And we can barely understand our own minds. It is the emotional layer within us, and it is a conglomeration of all our wants, our desires, our likes, our dislikes. So all this comprise of the very complicated and complex Manomaya Kosha. And still deeper than that is the Vijnanamaya Kosha, or the intellect, or the intellectual layer. That is the decision-making capacity of ourself, and even higher than the mind, and even more subtle. And we all have all of these layers. We have the intellectual layer. If you have ever, reached out for that gulab jamun, and then if you ever heard a voice behind saying, "Hey, you don't need that gulab jamun. You just overate your meal as it is. You don't need that gulab jamun. It's not going to make you feel good tomorrow." Then that was your Vijnanamaya Kosha in action. But the poor Vijnanamaya Kosha is usually, we don't pay too much attention to it. It's the Manomaya Kosha who is leading who is the main actor there. So, but we all have this Vijnanamaya Kosha, the intellectual layer, capable of discrimination, making good judgments, right? So even more finer and even more subtler is the Anandamaya Kosha. And this is pure existence. This is pure consciousness. And this is where we experience the bliss and highest freedom of operation. And we have transcended when we realize that we are not merely this body, not merely this Pranamaya Kosha, not merely the mind. We are not the Vijnanamaya Kosha. And we can transcend all of those and stay in that complete silence and bliss. Then we are in that Anandamaya Kosha. And that is where some of the greatest yogis, they have had experiential, they have had an experience of this Anandamaya Kosha. Okay. So we do have all these aspects within us most of the time, right? We have experienced this, even the Anandamaya Kosha. When you eat that gulab jamun, in that 1 second, you experience that ananda. So that ananda or happiness is no different from the happiness that one experiences, what the yogi might have experienced. It's just that we experience it as a momentary thing, but the yogi experiences it on a continual basis. So where do all the troubles begin then? It begins at the Manomaya Kosha. That is what is said in the yogic literature. So this is where we have very strong likes and dislikes. And we have very strong attachments and aversive tendencies known as vasanas. And if these are not properly channelized, then what could happen to the mind? It could lead to unnecessary looped speed of the mind. You're constantly thinking, and there is no way out of that thought pattern. So constant thinking, 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 it leads to speed of the mind, right? And what happens? How does the speed affect? It not only affects the mind, but now the effects are beginning to seep into the other layers. They begin to affect your pranamaya kosha. They affect your respiration, right? Respiration is a function of the pranamaya kosha. So it affects your breath, it affects your prana, and then from there it begins to affect your physical health. It seeps into the Annamaya Kosha, and over a long period of time, when this kind of looping of the mind or speed of the mind is going on in a very persistent, uncontrollable way for long periods of time, the changes begin to manifest in the physical aspect of our being as well. And it manifests as diabetes or back pain or whatever. In different people, it manifests as different things depending what our own genetic tendencies are. So depending on our own genetic tendencies, wherever the weakest link is, that is where the ailment crops up. So at Yoga Bharati, we just want to understand what is yoga now. So we believe that yoga is a conscious process of going back to our own true nature and trying to understand what is our true nature at each of these koshas that we looked at. So at the Annamaya Kosha, what is the true nature? How should we be? What is our most natural state? Our natural state is to be bursting with vitality, with energy, with good health. And we have come away from that. And yoga is a conscious process of going back to that state of health and well-being at the physical level. Then how about at the Pranamaya Kosha? The natural state, visualize a baby. It's lying there and just breathing. And if you watched a sleeping baby, it's beautifully breathing. Its abdomen is just bulging out and relaxed, right? And that is what we are. That is our true nature. And we have come away from there because of the demands of life. We have come away from that. And we are breathing haphazardly. Sometimes we don't breathe. Sometimes we are exerting ourselves when we breathe, right? So all kinds of irregular breathing habits. So going back to that state is yoga. At the mind level, worrying too much, being anxious, being led by the mind rather than gaining a mastery of the mind, anxiety, depression. So all these are symptoms that we have come away from a natural state of being calm and collected and equanimous, right? We have come away from there. So what do we need to do? Go back to that place of centeredness. So that is yoga. And at the Vijnanamaya Kosha, what is it? Intellect. So our intellect in modern world is extremely sharp. We all are intellectual. We are capable of understanding so many things. And yet the intellect is also a double-edged sword. Sometimes you overthink, you use it for purposes that do not lead to any higher purposes, right? So when that happens, then we have come away from the Vijnanamaya Kosha at its we have come away from our true nature, and then we need to go back. And that's where the correction needs to happen. And of course, at Anandamaya Kosha, it is you are completely blissful and silence. And when you transcend all these other koshas, then that is where you reside in that place of bliss and silence. So few definitions of yoga as per our great sages here, Maharshi Patanjali, who says that yoga is the mastery of the mind. Yogaha chitta vritti nirodha. And Sage Vashishta says in the Yoga Vashishta, Manaha Prashamanopayaha. It's a technique to calm down the mind. So as you can see, both these definitions, you're beginning to see there's something common here, right? They're talking about the mind. One is the mastery of the mind. One is saying it's a technique to calm down the mind. So see how important they figured out, they figured out so many thousands of years ago that the issue lies in the mind. And if the issue lies there, then the upaya or the solution also is there in the mind. If back pain began in the mind, then the solution to the back pain must lie in the mind, is what we can infer from these texts. right? And in the Bhagavad Gita, Sri Krishna says that yoga is a state of harmony. Samatvam yoga uchyate. So no matter sukha, dukkha, labha, jaya, whatever is thrown at you, right? Uh, whatever is thrown, whatever life throws at us, if you can maintain that inner state of harmony, if you can maintain that equipoise, then that is yoga. And finally, he also says yoga is a skill of working. So can you work with complete relaxation? Yes, we all have to strive, we all have to work in this world. And nobody can be without, can sit still without doing work. But as you work, can you maintain that inner state of relaxation? Can you not fritter away the energy in useless thinking? Can you focus on your work and give 100% to this work today rather than thinking of the results which are yet to come or the past, right? So he is giving you a technique right here to how to work in complete relaxation. So this is an important thing to understand that, so what is stress? So stress and back pain, they have a relationship, right? Back pain happens when the stress is greater than the relaxation. So stress is very important. It's our own body's response to highly demanding situations. And the sympathetic nervous system kicks in when you anticipate, when the body or when the mind anticipates a stressful situation, the sympathetic nervous system kicks in, and then there is a stress response. A bunch of things, physiological things happen in your body, including tightening of the muscles, right? And these are involuntary, it happens on its own. So the minute the mind detects that there is a stressful situation coming up, or if the stressful situation is already there, then it kicks in the sympathetic response. And a bunch of things happen at your physiological level, and you respond, you're able to cope up with that demanding situation. You are either fighting that demanding situation or you are fleeing from that demanding situation. But luckily for us, the body also has another aspect to it. It has the parasympathetic nervous system. And this is the part that is the rest and digest portion. And it says, okay, now you coped up with this stressful situation. It's time to relax. Let's bring back all those parameters down, right? And usually the body takes care of you. These two aspects of your nervous system, they're constantly having a little seesaw, balancing act, and you are taken care of. But sometimes if you are constantly stressed, and if the stressful situations are more than the relaxation episodes, or stress is greater than the relaxation, then you end up with that back pain. You also end up with other issues, but since this is a back pain webinar, we're just focusing on back pain. So it is said that in the limbic cortex, there's a part of your brain when there is emotional speed. So we all have emotional speed, but sometimes you're not able to express it. This gets suppressed for whatever reason. So what happens in that case? In that case, your autonomic nervous system, some imbalances happen, and then you could end up with hypertension or hyperacidity. And the other thing that could be seen is an early aging or degenerative process. And that could cause degeneration of your spinal components, and you could end up with spondylosis that could lead to back pain. At your voluntary nervous system, you are unable to relax, or you do not have or do not know the tools to consciously relax. So your muscles have gone into the spasm because your mind has perceived there's something stressful going on, right? So your muscles have gone into the spasm, and most of the back pain, it is said, is due to muscle spasm. There are other reasons like trauma, injury, and fractures and osteoporosis, but a majority of the back pain that most of us have is because of muscle spasms. So that could be another reason. And then it could also affect your endocrine or immune system, and then that could lead to autoimmune spondylitis, and you could be prone to infections, and that could also lead to back pain. So this is a little pathway showing you the relationship between what happens in your mind and how it percolates through your physiology down to your muscles, down to the vertebrae, and how it could cause pain and how it could manifest in the physical body. So then moving on to the integrated approach of yoga therapy. So here at Yoga Bharati, we follow the integrated approach. So if
Vinita,
yeah,
just sorry for interruption. Can we just announce the courses before we move on with the, because we are getting to the top of the hour.
okay.
So if we
So
can just announce.
yeah, we can, you want to announce the courses or?
Well,
Yeah.
this is part of the beauty of HUA, the integrative approach. Even in the webinar, you had some asanas, but all of this research that goes behind it in the class, in the course, you're going to get all of this in over 11 weeks,
Yeah.
individual attention, learning management system. And the course is how you can really connect with this at a deeper level. Vinutaji, I don't know if you want to finish the presentation or how much longer you have in your
I
PowerPoint,
have
or if you want to talk about the course specifically.
Yeah, I have 3 more slides, and I'm not going to go too deep into them because this is what is going to be taught in the course. So this is basically it. I have 4 more slides, and I have 4 more minutes. If I can take 4 minutes to finish, or I can just go on. It's up to you because I'm not sure how long the webinar should be.
Yeah, finish up and then we'll take more questions we'll take questions afterwards, but I'll drop some information about the course into the chat right now,
Okay.
and we'll get a poll after you finish your presentation going.
Okay.
So please stay around. This is now you're going to get the opportunity to ask your questions and we'll answer them. But thank you, Vinitaji. Sorry for interrupting.
Okay. Uh, so if we are that Panchakosha, we have the 5 layers of, we exist as those 5 aspects of 5 layers. Then it is common sense, right? Whatever therapy that we do has to address all those 5 layers. You're not just the Annamaya Kosha, and if you have a back pain and you're constantly trying to fix your back, that's going to be effective, maybe like 50%. But what about the other aspects of your being? Right? So the integrated approach of yoga is where you address the issues, look at you as a complete, like a whole person comprising of all these aspects, and therapy is applied to all these aspects of your being. So at the physical aspect, we have asanas and kriyas, diet and bandhas, and not all of these will be introduced in the back pain class, but as a general, general information. So at the Pranamaya Kosha, we have pranayama practices. At the Manomaya Kosha, we have meditation techniques. We have bhajans and karma yoga. And to address imbalances in the Vijnanamaya Kosha for intellectual stimulation or intellectual curiosity, people who like to challenge their intellect. So we introduce happiness analysis, there's yogic counseling as well. And at the Anandamaya Kosha, of course, there's a layer of complete bliss and silence, and you're working to maintain this. And any habitual thought patterns and tendencies, we all have that. And they have a name for it in the yoga terminology. It's called vasanas. So removing those habitual thought patterns, that is what we do at the Anandamaya Kosha. And we will have sessions on vasanas, we will have happiness analysis, and more on each one of these will be there in the course. So some of the practices that we are going to do here, we are going to give you a lot of movement, right? Through breath and body synchronization practices, Sukshma Vyayam, modified Surya Namaskar, specifically designed for back pain, some asanas towards the end of the course. And you're going to be getting to stretch the muscles, strengthen the muscles, and improve the flexibility. So those are the principles for back pain management. And then teaching you how to coordinate the breath with the body movements, teaching you how to breathe. And it has been found out that as the breath slows down, the mind also slows down. So teaching you how to breathe, then some relaxation techniques like DRT, abdominal breathing. So all these techniques are going to be introduced as well. And we're going to be doing a whole lot of chanting, Om chanting and other mantras. And of course, these are all optional. If you don't want to chant, you can stay away from that. But these have been found to calm down the verbal mind. And we have a few imagery and visualization techniques to calm down the visual mind, or even as simple as visualizing the pain going away, visualizing the pain melting away. So we are going to have meditation, cyclic meditation, MSRT, Om meditation, and we also have discussions on what are vasanas, what is life, and then stress is a response to the situation. It is not the situation itself, and to be stressed is a choice. So some of those, so it's, as you can see, it's all part of the yogic techniques. It's a whole package, and it's not just addressing your back pain or your neck pain. So we also have application of Ashtanga yoga concepts in Bhagavad Gita to reduce your own stress and conflicts that we constantly face in life on a day-to-day basis. So those are some of the techniques we are going to use. And then, of course, a little bit of information will be given on each one of these aspects. Not too much. We are not dietitians, so there'll be a little bit of information coming up on those aspects as well. So this particular course, let me go through this course first in detail, and then we'll go on to the other courses. As you know, as you might already know, it's from April 11th of April to 20th of June for 11 weeks every Sunday. And it's a 2-hour class, and the timings are there depending on where you stay. You can, it's 7 o'clock or 4 o'clock PST. And then it involves the practice aspect. So we are going to teach you some of those physical practices that I was mentioning earlier, and the pranayama, the relaxation, all these things will be taught to you. And at the end of the course, you'll be empowered to manage your own back pain. And by developing those coping skills that we were talking about earlier, and just subtle awareness of your own body. And the theory aspect would involve discussions and talks by different people on the integrated approach of yoga that we just discussed, right? And then the causes of back pain, we didn't touch upon all that today, but the role of stress, then what are vasanas, pranayama concepts, yama niyamas, and the 4 streams of yoga: Raja Yoga, Karma Yoga, Jnana Yoga, and Bhakti Yoga. And we'll also be doing simple assignments, simple reflections of any one of these topics. And it could be a simple reflection and is needed if you're looking for course completion. And then we'll also be doing a little health assessment in the beginning to assess your own health requirements. And this is really important, as this is a group class and we are all online, and we want to make sure everybody stays safe. So that's a little overview of the course itself. And that comes to the end of this presentation. And now I'll move on to the, Ashwini, do you want to give the other one, or do you want me to do it?
Go ahead.
Okay.
So just stay back. We just are going to announce some very interesting courses apart from the back pain one. Just stay back for a couple more minutes.
I should have expected, Vinutaji, for you to have a proper PowerPoint slide explaining the course and all those details. So you're going to go over some of the other yoga studies at HUA. In the meantime, I'm dropping a poll. Please fill this out. If you're interested in this course on back pain, just let us know right here. We'll follow up and we can get you plugged into that course. Thank you for that. Please fill that out. And go back to you, Vinutaji.
Okay, so let's
you can go straight to those 3 slides since you already explained the course related stuff. The course on the back pain, and then we have some teacher training, a little teacher training for children's yoga, all of that. So just listen to those, only 3 more slides for you guys, and we'll ask questions. We'll allow for questions after that. Thank you.
So this one I already explained, and that's the same thing. And the dates are here, and the duration is for 11 weeks. And this is our back pain course that is upcoming this spring quarter. And then the next course that we are offering is teaching yoga for children. So if you work with children, maybe at a school setting, or maybe a special needs setting, and you want to teach them yoga, how do you teach them? What do you teach them? So this is for people looking to teach yoga for children. And it's a 5-credit course. It's going to be offered between April 24th and May 3rd, every Saturday and Sunday. And the timings are right here. If you're on the East Coast, 10 a.m. to 3:30. If you're in the West Coast, Pacific time, 7 a.m. to 12:30. And then it's a 5-weekend course. After that, there will be a self-paced internship where you will be shadowing with some of the teachers who are already teaching these yoga classes for kids. There'll be a little bit of practicum training. You will be teaching, and then finally preparation of a field report. And how can you benefit from this? You can include yoga in, if you're a teacher already, then you can include this yoga in your teaching career. If you're already a yoga teacher and you want to specialize in teaching yoga to children, then you can do this course. Or simply you're a parent and you want to introduce this to your kids, then this is also something that you can take up. Or if you work with special needs kids, then you can do this course as well. So as you can see, different kinds of people can take up this course. And what is the what are you going to do in this course or learn in this course? You learn handling children's needs, physical, mental, and emotional. So this is the yoga studies schedule. And if you're interested in any one of these courses, you can write to us. So the first one is the back pain, of course, 2 credits, spring 2021. And then upcoming in April 24th is the 5 credit teaching yoga for children course. And then after that, we have the youth yoga teacher training for teens, 13 years to 18 years, 6 credit course. That will be in the summer of 2021. And fall of 2021, we have yoga teacher training, which is 18 credits in case you're looking to be a yoga teacher or just learn more about yoga in an in-depth way. So anything else, Ashwini, do you want to add anything else? Or
that's about it. Thank you. And any questions? We are here.
Yeah, one of the things that people are asking is how much will this course on back pain cost? Glad to announce a 24-hour $100 discount. It's usually $400 for the next, 24, maybe 36 hours. It's only going to be $300. So please sign up quick. I have about 60 out of 111 people who have filled out the survey so far. Please fill it out. Yes, no, either way. That way we know to follow up with you or not to follow up with you if you don't want to. Please fill out that survey. We have questions coming in. Let's put them in the Q&A box so that we can keep track of them and answer them. I think Ashwini Ji was already answered like 14 of them as they've come up. We have a couple hands up also in the panelist window. I don't know if you want to just type your question in or if you have a specific thing that you want to say. And I don't know if you've been following other aspects that were asked, if you want to address them, but please go ahead. Ashwini Ji or Vinuta Ji.
Okay, so how do I, okay, the chat, right? You're saying the chat, look at the chat.
No. The chat, we're asking people not to put questions in the chat because it just flows and it's hard to keep track of, right? The Q&A box keeps the questions and allows us to answer them. Somebody's asking about prerequisites. Are there any prerequisites for the course?
Ashwini, do you want to answer that? I think they're talking about the back.
There are no, for back pain course, there's no prerequisite. However, we are going to ask you to participate in a health assessment. We would like to understand your health and then suggest whether the course is, fit for you or not, because sometimes when you have either in any extreme condition, you may need a one-on-one assistance. In that case, we would have to ask you to join our one-on-one before you join the course. We would like you to join the course, and this course is meant for back pain, but however, we need to understand that, okay? So understand your condition. So that's the only prerequisite to participate in the health evaluation, your health evaluation.
I see Ashwini Ji is typing in an answer to Balaji's question. Is there homework and how much is there in the course?
Yeah, like I was just going to type, not much homework, but more of a, your own reflections, your own practice, your own, the whole idea is for us to help you with your back pain. Or help, even if you are looking for a course as a teacher and you would like to join, contact us, and we would like to also help you to understand that way the practices that you would have to pretend to be back pain participant and pretty much follow the whole curriculum of what we say in terms of practice for the most part and reflections. They are not like some super difficult homework. It's more about practice and reflection. That not very difficult.
So
it is what you get out of it, right? It is what you put into it is what you get out of it.
Exactly. And yes, you can only attend and leave. You will still benefit, but not as immensely as when you practice and do all the assignments.
So I think Sushi Ji has a question. I have some knee problem. Can I still become a yoga teacher? Yes, you can. So you work on your knee, you get better. And then in the meantime, you also pick up the training, train to be a yoga teacher. And then maybe you can help other people with knee pain, right? Talk from experience, look at your own healing. And then you become a better ambassador to that, to this modality, to this yoga modality.
One other question was, is there another course post April 11, if schedule doesn't present currently? Yes, we do bring these courses. Alternately, we bring holistic yoga and alternately back pain course around the same exact time, Sunday around 4 p.m. So if it is not convenient for you now, we usually bring it, I think winter, right? Winter time frame as well. So yeah.
And we have so many courses at HUA in this yoga framework also. So I know you've taught managing diabetes with yoga, right? Tomorrow we have a webinar on yoga and the Bhagavad Gita specifically. So there's so many different aspects of yoga that HUA is presenting and bringing to you. We hope you will participate in some way. Find the course that fits what you need and join us on this dharmic mission. Somebody asked, do you get to learn some shlokas? I don't know if you include some of that in the back pain course. If you want to talk about how you integrate that.
Shloka and Bhagavad Gita concepts and Yoga Sutra concepts are all basis. Our basis is Bhagavad Gita and Patanjali Yoga Sutra for even yoga as a therapy, yoga for healing. Yoga is for healing. Yoga is for health. Health and healing are not two separate terms, because if you are swastha in yourself, established in yourself, then you are healthy, and then you are peaceful, and then you are also compassionate. You cannot be compassionate when you are yourself sitting in in the pain in the bed. So yes, Bhagavad Gita is part of it. Do we teach you to chant and things like that? No, because then you need to join Bhagavad Gita course, which is starting tomorrow, as Ankur said. So the focus is not going to be shloka, but shlokas are part of our yoga.
People are also asking about the replay. The webinar replay will be sent out to everyone who registered. If there are any particular links that you think we should include, we'll send that out to everyone. Please complete the survey. We have 74 out of 89. Almost 33 people are interested in taking the course. That's great to hear. I think if we got over 30 people, it would be a nice problem a nice classroom to manage and support. And we have multiple teachers, so we'll be able to give you specific attention. And I took holistic yoga with Ashwini ji back in, I don't know if it was a couple quarters ago, but through this Zoom modality, you might not think that you'll get that individual attention, but you do, especially if you turn on your camera and you're being engaged, right? So we don't have a Bhagavad Gita course starting tomorrow. We have a webinar. Just like this was a webinar with yoga for back pain. Tomorrow we have a webinar on yoga and the Bhagavad Gita at 3 p.m. Pacific. You should get an email about that later today if you didn't register already. But we are here to talk about yoga for back pain, making you feel better, helping you address your concerns, and turning you into, or helping you on your path in whatever way that is. Any more questions? No more in the Q&A box. Let me share the polling so you can see. That's what it looks like right there for this. I don't know, closing thoughts then, if we don't have any more questions?
Vinita, go ahead.
Yeah, closing thoughts is I'm hoping that I was able to convince you based on the evidence that we have, and a lot of people are wondering where all this is coming from. How come people are saying yoga can get rid of back pain? How come nobody else is talking about it, right? How come my doctor is not recommending it? Such questions always come up. So people are a little bit skeptical when we make claims like yoga can treat back pain, you can get rid of your back pain, get rid of your diabetes. So a little bit of skepticism is there. And I know some of you might have felt, where is this going? But it's important to show that there's research being done in this area. Yoga for low back pain, yoga for diabetes, a lot of research is there, and we are slowly getting And we are hoping that we will reach a critical mass where people will say, my cousin so-and-so went to a yoga class, and then, hey, doctor, can you recommend me? Can I go for the yoga class? So that's the goal of bringing in the evidence-based approach to yoga. And I'm hoping to see some of you at least in the class. Thank you.
Yeah, and Bhagavad Gita, there is one question on where is the Bhagavad Gita link? Can you just put the link on the chat as the last thing? What is the Bhagavad Gita course starting tomorrow? That's the question. Last question. And so contact us for any questions, ankur.patel@hua.edu. And if you have any questions, HUA website has all, even the chat window there, like online help. So if you can always like chat online when you go to the website. Okay. Are we going to close, Ankur? Yeah, there is the link for Bhagavad Gita for tomorrow's course. And our course will be beginning so there is the discount is extended for 36 hours, right? Okay, so do sign up if you want discount.
I think there's one more question, and I don't know if you answered it, Ashwini. This is so timely. I was looking for online yoga therapists. Would you provide or connect me with one-on-one resources for back pain and other issues?
Absolutely. Contact us. Therapy@yogabharati.org. That's also another, if you have a special request, we'll prepare you for the course. So therapy@yogabharati.org for any questions.
Yes, beautiful. That's what Hindu University of America is, a place for Hindus across the world, for different organizations, for our dharmic values, teachings, including yoga, to get out there, bring you in, and build this platform for Hindus across the world. Please participate. Join this course in particular. I think it was amazing to bring that research and the practicality of it together. If you haven't taken the Orientation to Hindu Studies course, that's a good place to start. The next quarter starts that second week of April. Please join us on this dharmic mission. We appreciate you. Thank you, Vinuta ji. Thank you, Ashwini ji, for being here. Thank you, everyone, for attending on this Saturday. We'll see you at the next one or in class. Namaste.
Thank you, Ankur. Thank you, Ashwini.
Thank you.